am Jamie Charles, a head nurse employed by the NCRHA at the Couva Medical and Multi-Training Facility. I have been working with COVID patients for nearly 2 years and have been a practicing registered nurse for the past 12 years. As part of my country's response to the COVID-19 pandemic, I was initially posted at the Arima General Hospital to assist in the management of suspect and confirmed COVID patients. However, in April of last year, I was reassigned to CMMF along with several of my colleagues where we have been since. Today, I am pleased to share a glimpse of what patients experience while warded at the nation's quarantine facilities. And it is my hope that this presentation can encourage at least one unvaccinated person to get vaccinated. There is no doubt that patients and their loved ones face uncertainty when admitted to the nation's quarantine facilities after being infected with the SARS-CoV-2 virus. They feel stripped of their independence, freedom of movement, and even the physical touch they would normally receive from their loved ones at home. They aren't allowed visiting hours and are usually confined to their bed. Those who recover are sometimes faced with a debilitating group of symptoms known as long COVID syndrome. Long COVID, as defined by the WHO, is a group of symptoms that some persons experience after they have recovered from COVID-19. Some of the common symptoms patients experience include shortness of breath, cognitive dysfunction, also known as brain fog, fatigue, chest pain, muscle pain, difficulty sleeping, and anxiety. The duration of these symptoms is not completely clear. Treatment by a multidisciplinary team, which includes a primary care physician, mental health professionals, and other specialist physicians, is needed. At the Arima General Hospital, the Executive Wellness Clinic has been operating just after the commencement of this country's COVID-19 pandemic response to alleviate the clinical burden of long COVID sufferers. The EWC provides these patients with the necessary aftercare to deal with their daily lives. It comprises of nursing staff, junior medical officers, specialist medical officers such as internal medicine, nephrology, cardiology, and thoracic medicine, etc., medical social workers, physiotherapists, and pharmacists. Additionally, some of these patients may access psychiatric services whether by clinical or self-referral. This multidisciplinary approach is carried out in order to get patients back to their regular lives as quickly as possible. It is of utmost importance to understand that the sufferers of long COVID can be both hospitalized and non-hospitalized infections. One must appreciate that this includes those who are either asymptomatic or have very low symptomaticity. Where I work, we have had many patients battling this disease for longer than their expected quarantine period. The vast majority of them are sometimes afflicted by a multitude of comorbidities ranging from chronic disease, cancer, mental illness, gynecological or obstetric illness, social issues, etc. While they are warded and when they are seen in subsequent clinics, this same multidisciplinary approach is applied. Yes, there are instances when certain medical specialties may not be immediately available to COVID-19 patients while they are under state quarantine. However, they are referred upon discharge and at the end of their quarantine. As part of the nursing team at the Couva Hospital, my team, with the support and guidance from senior management, spare no effort in ensuring our patients receive the best possible care offered and spread a little cheer and positivity. So here I would like to show you a few slides of some of my team donned in their PPE who have gone the extra mile to put a smile on the faces of their patients. Can I have slide 2 and slide 3? While I can easily say the NCRHA has put an army together to wage war against this virus, I must make my position clear. Preventing COVID-19 infection is the best way of preventing the development of post-COVID-19 symptoms or long COVID. Therefore, vaccination along with social distancing, regular hand washing, sanitizing, and mask wearing reduces the risk of infection, hospitalization, and mortality by a significant number. I would like to encourage and plead with all citizens who are currently unvaccinated to make the right choice. The fact remains that the percentage of unvaccinated persons at the nation's quarantine facilities immensely outnumber their vaccinated counterparts. While many of us crave freedom from restrictions, consider this. I have seen every creed, race and age and socioeconomic class fall victim to this deadly virus. Vaccines can provide us with a crucial component in the fight against COVID-19. While many of you remain hesitant, I urge you to empower yourself with facts, knowledge, and relatable information about vaccines and stay clear from misguided persons and misinformation. It is often seen that health is not valued until sickness comes. So please value your health and get vaccinated today.